for a long time, I didn't have insurance at all. You just kind of let things go that you shouldn't let go. There was a few times where I'd obviously broken a bone, like my hand or my foot, and I was just like, it's fine, I'll walk it off or I'll let it go. Can't afford to pay the bill, can't afford to go to a specialist. So.
That is the voice of Covington resident Jake Caldwell, who is 31. He also has a chronic liver disease. If he had gone to the doctor sooner, it might not have gotten this far. But what else could he do? Because he didn't have health insurance or a way to pay for care out of pocket, he avoided going to the doctor for years. Like Caldwell, 276,000 Kentuckians are without health insurance. Fear over the cost of healthcare and misunderstandings about eligibility are leading factors, according to a survey of uninsured individuals by the Urban Institute, a Washington, D.C. based think tank focused on economic and social policy research. The rate of uninsured is highest for young adults between ages 19 and 34. Caldwell, like many in that situation, was young and relatively healthy, or so he thought. He eventually ended up going to the emergency room and was told he had a form of hepatitis brought on by fatty liver and was instructed to lose weight.
Hope can only get you so far. Like, you can hope things don't go bad, you can hope things get better, but that can only get you so far before you actually need to take some action for yourself. I don't know, my best piece of advice would be just look for help that's out there.
St. Elizabeth Healthcare has a number of programs to help patients who are uninsured. Those who are insured but have trouble paying out-of-pocket cost, or those finding themselves struggling financially due to a medical emergency or issue. The hospital takes a layered approach, says Tony Helton, Vice President of the Revenue Cycle Department of St. Elizabeth. First and foremost is patient confidentiality when it comes to finances.
So there's really several layers in the question. So when someone comes in, let's say through the emergency room, and they have no insurance, first off, the clinical team has no idea that they are uninsured. We have the program, we work, it's an external group that they review all of our uninsured patients to see if potentially they're eligible for Medicaid. And if you look at the past 13 months, our average conversion rate from self-pay to Medicaid is about 60%. Then you go into the other 40%. What about them? And so we have, it's basically a 5-tier program. So internally, we have a financial assistance program that is based on your income level and how that equates to the federal poverty guidelines. So if you're at 100% of federal poverty guidelines, you get 100% assistance. That as soon as we can identify you can't pay a bill, let's get it taken care of. Either let's get you on Medicaid, let's fill out this application, let's get this up. You don't have to worry. Because the other side of this is we don't want to build a barrier to access. Mm-hmm. We want to remove that because we are the provider of Northern Kentucky. And we don't want someone suffering and not coming into the hospital because they're worried about a bill.
It was clear to note that providers and healthcare staff at St. Elizabeth do not know who is insured and who is not. Research has shown that patients' fear about stigma and lower quality of care associated with Medicaid and similar public health coverage are not unfounded. In 2022, the Urban Institute interviewed Medicaid and uninsured patients and reported about 8% of respondents reported experiencing unfair treatment or judgment either because of the health insurance type alone or in combination with other factors in a clinic setting. A report by the Tulane School of Public Health and Tropical Medicine in 2021 noted that physicians can and do refuse patients based on financial factors. The research found primary care physicians offered Medicaid patients 27.6% fewer appointments than privately insured patients. Mike Kadev's system director for the department put it into numbers. Though its financial assistance program, the portion owned by the patient after insurance, would be cut in half for those who make between 200 and 300% of the federal poverty line. For those whose incomes are higher, up to 4 times of the poverty line, the program would cover a quarter of the patient portion of the cost of care.
That they might be eligible for.
So when you talk about uninsured, people with no insurance, that number is low now, at under 2%. Because of the Medicaid expansion program, now more people are qualified for, eligible for Medicaid. So that uninsured population is under 2%. But people who can get discounted or fall under 200% federal poverty guidelines, and they have Medicare and all, that number is pretty high. I would say probably 30 to 40% our patients get some sort of discount or financial assistance. Medicare expansion on January 1st, 2014, when that happened, then it suddenly, your Medicaid population doubled. Before that, it was only very small group of our population was eligible for Medicaid. But after that, it entirely became based on income. Before it was based on your children, your pregnant women, or your elderly, but after that it just became based on your income. So anybody can now, as long as your income is within that 138% federal poverty guidelines, you're eligible for Medicaid, regardless of your age or.
When in doubt, ask. But also utilize the website, my chart, the tools that we try to put out there to make it readily available. Our biggest goal is to reduce the barriers of entry so that we keep our community healthy. Pure and simple. And we don't want anyone suffering because of healthcare bills. And that's the reason we go so far to make sure that we're doing everything that we can within the limits, the guidelines, so that if someone's eligible, we want to make sure that they have access.
Doctor's visits and hospital stays are 2 parts of the trifecta of medical costs. The third is the skyrocketing costs of prescription drugs. The U.S. Centers for Disease Control and Prevention, the CDC, report that more than 9 million people skipped or skimped on their prescriptions last year because they could not afford them. Aaron Broomall, Executive Director of Faith Community Pharmacy, has seen it firsthand. While many of its patients are on Medicaid or Medicare, the organization helps those with insurance too, as long as they meet the financial threshold.
Oh my gosh, I think it's something like 30% of Kentuckians have gone without healthcare because of cost. It might even be higher than that. There's some crazy, ridiculous numbers of what happens. And literally every day we have people come in here and tell us stories of husband and wives who they would go, and they're both diabetic. They could afford $50 in insulin a month. They would buy that much and then they would share it to get to the month. We have grandparents come in with kids who the kids just got placed with them. They couldn't get in Medicare yet or Medicaid yet. And the child needs mental health medication for emergency circumstances and they can't afford it. Every day it happens. What we see, and this just tells you that access to medication is the huge problem. What we see is patients in their first year in our program see a 60% reduction in ER visits and a 70% reduction in hospitalizations. So what's happening is before they come to us, they're rationing or not taking medicine, which means their disease state isn't properly being cared for. So they're going to the hospital. They're utilizing a whole lot of very expensive resources. And the best way to avoid that is just ensure they can get the medication they need. And we're lucky enough that we get to do that here. We're pretty unique. There aren't a ton of charitable pharmacies across the United States. We're by far the largest in Kentucky. And so Northern Kentucky is pretty lucky to have a resource like this.
The pharmacy was started in 2002 while always a separate entity. It partnered with St. Vincent de Paul and Crestview Hills until moving into its own building in Florence. Last year it made another move to 601 Washington Avenue in Newport.
So we partnered with them, but we've always been an independent organization. In 2010, we outgrew the space that they had there and we moved into our own space. And to avoid confusion, that's when we started using Faith Community Pharmacy. And then we moved from that location in Florence to this location here in Newport in June of last year. So we've been here for about a year.
The pharmacy sees about 1,000 patients each year and gives away 24,000 90-day prescriptions valued at more than $4 million, Broomall said.
So our only qualifications are that you have to live in northern Kentucky, and that's very broadly defined. So right now we have patients in 13 different counties in Kentucky. So very broadly defined northern Kentucky. And you have to earn less than 300% of the federal poverty level. You can have insurance that is regardless. If you come to us and say you can't afford your prescriptions, those are the only qualifications. Now, we do work with you on your insurance side to identify those that you can get for free. We don't want to give you the ones that you can get for free. But there are many people that can't afford $2 or $5 for a copay. And our average patient is receiving 9 different medications from us. So it's not, you can't think of it as, well, $7 sounds pretty affordable for copays. Well, it is, but if you have 9 of them, that's $63. And our average patient has a household income of less than $24,000 a year. So those stack on top of each other and they become very, very difficult. So we do have fairly few Medicaid patients, although Kentucky has private providers providing Medicaid. And so you can be on Medicaid and be prescribed a medication that's not on your formulary and still not be able to afford it. And I know I told you that, but people just assume that is not the case. You can have insurance and we will help you. It really, the qualifier is you just can't, you have to not be able to afford what you're given. We do, like I said, we carry those 5 key areas that we focus on. And we don't carry every drug. We're not, we try to cover 1 drug in each class, which is what we can get our hands on. And but we work very closely with individuals, physicians, and everything else to ensure that they're getting the best care possible.
Every expert interviewed for this story had a similar piece of advice for those who are uninsured or struggling to afford their medical bills, premiums, and copays. Don't put it off. The sooner you seek care, the better it will be for your health, your finances, and for the community. Although the number of people who are uninsured has dropped dramatically in recent years thanks to available programs, it is difficult to get help if you have no income, are experiencing homelessness, or are undocumented. For people and families experiencing homelessness, medical services are spotty, but there is help available. Here are a few resources in our area that have some medical outreach or can help people find additional health resources.